IMG 340, spine CT imaging. CT has mostly replaced plain films on the C-spine on trauma patients because it often detects injuries not detectable otherwise on regular general radiography films. A certain type of pathological overlap is seen in the cervical region on CT imaging because conditions affecting the vessels, bones, and soft tissue are often found when one type of cervical exam is done. For example, a patient may be having a CTA exam of the neck performed on him or her, but abnormalities with other body parts can be found on the CT as well, like possibly with the thyroid gland, neck muscles, or another type of anatomy. Carotid or vertebral arteries may be injured, such as in trauma situations, and this can result in dissection or occlusion of the arteries, which is extremely severe and critical. And this can happen during the violent neck motion that may cause a fracture from the trauma situation. The C-spine CT often shows common findings, such as carotid stenosis, spinal trauma, scoliosis, lesions of vertebral bodies, osteomyelitis, disc herniation, spinal stenosis, and carotid bifurcation calcification, which is known to be a potential a potential cause of a stroke or a TIA. Tumors affecting the spine or spinal cord can originate here as primary tumors and then metastasize to the bone or soft tissue, and treatment often requires a great deal of bone removal. So usually for cervical, thoracic, and lumbar spine imaging regarding CT, spine images are acquired in the transverse plane. This is done using the helical technique, and it's also done possibly by tilting the gantry. The coronal and sagittal images are then reformatted from those transverse images, and these reformatted images can show things like scoliosis or spondylolisthesis. Spine CT imaging differentiates the disc from the adjacent ligamentum flavum, the thecal sac, the intraspinal fat, and the bone. And on spine CT images, the nerve roots are easily seen as they exit through the intervertebral foramina. These are just all a few reasons why spine CT imaging is important. Spine imaging is usually acquired by either the perpendicular to tabletop method or by tilting the gantry to align the plane of section with the vertebral body end plate. However, depending on what type of equipment you have, sometimes equipment doesn't have the function to tilt the gantry with helical scanning. Common algorithms or kernels that are used are bone and soft tissue, and spine imaging can be done with or without contrast. Disc disease, spinal stenosis, and trauma do not need contrast administered for exams. Cervical disc herniation is usually more difficult to diagnose than, say, an L-spine herniation due to its curved outline and the smaller size of the cervical region as compared to the lumbar. IV contrast is used frequently to better outline a cervical disc herniation since it highlights the epidural veins in the cervical region, and this is done with the drip infusion method. And when you are imaging a patient, you need to be sure to screen the patient for the contrast questionnaire that your facility may have, and you need to give proper and clear exam instructions. Spine imaging in larger patients can be improved by increasing the technique, and this is done by increasing the KV and the scan time. The C-spine is imaged with a helical 1 to 2 millimeter slices when good bone detail is necessary and crucial, but 2.5 to 3 millimeter sequential slices are overlapped every 2 millimeters to look for disc herniation. Wide shoulders on a patient present for the challenge of C-spine imaging, so try to have the patient really relax their shoulders and reach for their toes to get the shoulders out of the way of the C6, C7 area. L-spine is imaged using 3 to 5 millimeter sequential slices every 3 to 4 millimeters, and an overlap of slices can be used for this as well. Here are just a few pictures of cervical C-spine images. All of these pictures are actually in the sagittal reformation stage. So the picture all the way to the left here shows what a normal cervical spine CT image should look like. But the picture in the middle, as you can see right here, shows a cervical dislocation at the spot with the arrow pointing to it. And the picture on the right here shows a cervical mass. And this is actually a cystic mass in the anterior neck. And you can even see that it is compressing the trachea here quite a bit.